Well, welcome everybody. Now, not a shot of tequila, that's for after, but okay. So, I want to thank everybody for coming. And what we're going to do today is basically teach you how to effectively treat chronic fatigue syndrome and fibromyalgia. And most of you are familiar with this. You've seen many, many people. How many of you see people with CFS and fibromyalgia regularly? A real common problem that they have coming in. And you've heard a lot of different things about effective treatment, different ways of treating the disease. What we're going to do today is a very clinically oriented approach that's going to give you the tools you need by the time this talk is done to effectively treat these patients in an organized manner. This is the same approach that we're using at the fibromyalgia and fatigue centers around the country and that have been used for tens of thousands of patients. Now, let's take a look, basically, what is chronic fatigue syndrome and fibromyalgia? There's many things. Oh, is it toxicity? Is it nutritional deficiencies? Is it a hormonal problem? What is it? And what you'll find is that basically CFS and fibromyalgia represent an energy crisis in the human body. It's where you're spending more energy than you can make, and the patient effectively blows a fuse. And once you understand this, you're going to find that these patients get well with some very simple treatments. So number one, this is an energy crisis. People have blown a fuse. Okay? Kind of like this pointer thing that, there we go. Okay. Now, question number two then, one that we get asked a lot by the media. Why are people getting more and more fatigue these days? Fatigue is becoming increasingly common. And we have the perfect storm that's occurring for a human energy crisis. Number one, the American diet, what's the technical term for it? Sucks. It's really horrible. If you take a look, it's what we call the standard American diet, where you'll see that 18% of our calories come from sugar, another 18% of calories come from white flour, and when you add in the added fats, half of the calories in our diet have nothing but calories. Vitamins and minerals are gone. Sleep, another key factor. If you want to get proper energy, you need to be getting good sleep. And the average night's sleep in the United States until 130 years ago, average, was 9 hours a night. How many of you are getting 9 hours a night? On average, most people are getting 6.5 hours sleep a night. So we're seeing a pay cut, basically of 30% in energy just from the lack of sleep. Hormonal deficiencies. You've heard a lot today about hormonal issues, and we'll hear from others. Dr. Wilson this afternoon will give an excellent talk about adrenal issues, and we hear about thyroid, estrogen, progesterone, a host of problems. Infections are a major problem. It's funny, they seem to be making Americans a pincushion for every possible infection that comes by with a vaccine. And although vaccines can be helpful, the answer isn't trying to vaccinate against every possible infection. It's to treat underlying immune function. And we'll talk about infections. And then there's the stress of modern life. Remember the good old days when Madison Avenue executives, when they wanted to advertise, their mantra was sex sells. You wanted to sell something, you put some pretty ladies up and some good-looking guys on the screen, and you put it next to whatever you're selling. Nowadays, the mantra is fear sells. And it is exhausting people energetically. Now, so we can see why people are facing a human energy crisis. But the good news is that effective treatment is available by using a mix of natural and prescription therapies. And we're going to talk about these today. Again, my main goal in being here today is to put this in an organized fashion so it's easy for you to apply day to day in your practice. So let's take a look at what's going on in CFS, chronic fatigue syndrome, fibromyalgia. Basically, ignore all the arguments where people are going, is this an infection. Is this a hormonal thing? It's an energy crisis. And just like blowing a fuse in your home, there are 100 ways to blow a fuse in the human body. Whatever the trigger for the energy crisis, once you start this chain reaction going, one problem triggers the next, triggers the others, and then basically you blow a fuse. And if you just take away what blew the fuse, it's not going to take care of the problem. If you plug in too many space heaters and then you unplug them, the circuit is still blown. You have to turn the circuit breaker back on. And the name of the circuit that's malfunctioning in fibromyalgia is called the hypothalamus. A little small area, not much bigger than a walnut or so. And it's in the brain, right above the pituitary. And this area controls many different functions in the body. The hypothalamus, let's take a look at that for a moment. The hypothalamus controls sleep. So when you have hypothalamic dysfunction, these patients, even though they're exhausted, can't sleep. In fact, I'll commonly lecture to 300, 400, 500 people with the disease, and I'll ask them, how many of you can get a good night's sleep without taking something?